So hello, my name is Margaret, and I'm going to tell you my story as a caregiver and a spouse for someone who was diagnosed with leukemia. He lived with this disease for 7 months before dying. But first I'd like to tell you a little bit about my husband of 42 years. Gary was a career military man. He was approaching retirement after 29 years of service, and we were starting to think about a second career for him as he was only in his mid-40s. But he did have one last deployment as a peacekeeper to Bosnia in the early 90s while they were embroiled in a civil war. 4 months into this peacekeeping UN mission, he woke one morning with severe headaches and limited vision. He was sent home, and after many investigations, it was determined that his vision loss was permanent. But also he was suffering mini strokes. So we needed to do something about these strokes, so he was put on very high doses of prednisone. We knew this couldn't last, so he was switched over to methotrexate for long-term use. It was then that we decided that we had to learn to deal with this permanent disability. It was very difficult for Gary. He was a man that was used to being in charge, and now he couldn't drive, he couldn't read, he couldn't watch TV. He felt that he had lost all independence. And I would say he was at least 2 years dealing with this with depression. It was about this time that we got a guide dog, and her name was Brandy. And what a positive difference this made in Gary's life. He now had a reason to get up in the morning. He had a reason to get outside, but most of all, it gave him some of his independence back. A few more years, I was working full-time and decided that I too should take early retirement as my family life was taking a priority. It was around this time that we started going to Florida for the winters. And it was our last trip there in 2013 that Gary started having symptoms. I noticed that he was covered in bruises, he was short of breath, and he was having dizzy spells and really feeling unwell. And after one of these bouts of dizziness and lightheadedness and just feeling miserable, I asked him if he wanted to go home to seek medical care. Gary agreed, and I knew at that point that he really wasn't feeling well. So we quickly packed up the house. It took us 2 days, and then we were on the road. And I must say that was the longest drive of our lives. It was on the way home that we both realized there was something very serious going on. At first I had thought that it might be something to do with the long-term methotrexate use, as the side effects were liver complications. And I thought, looking at his symptoms, that possibly could be it. But he was just so sick, and I think we both knew then that we were in for a long haul. In the ride home, Gary said to me, "Do you think I have cancer?" And I remember saying to him, "I don't know what's going on, but whatever it is, we're going to face it together, just like we have all your other health issues." So on arrival, we went directly to the emergency department. When we got there, they did blood work. They did a CT scan because of his past history of strokes. He had abdominal ultrasounds done. And probably about 5 hours after we were there, around 11 o'clock at night, they came and told us that they thought he had acute leukemia. They also said that because of Gary's blood work, he had a hemoglobin of 54 when it should have been around 130, that he needed to be admitted for blood transfusions and further investigations the next day. So we went directly to the hospital. Gary had blood work, head CT, abdominal ultrasound, and after several hours, around 11 p.m., we were told that he probably had acute leukemia. Gary was exhausted. His hemoglobin was only 54, and it should have been 130. No wonder he was weak and short of breath. He was being admitted the next day for more tests and blood transfusions. I went home to an empty house to process this news. Since we were home early from Florida, we didn't have cable, telephone, or internet. The only resource I had were 30-year-old nursing textbooks. I didn't sleep a week. I pored over them all night long. The next few days were spent trying to determine what kind of leukemia Gary had and to stabilize his blood. He was discharged with an appointment for the following week to go to the cancer clinic, and that's when they would tell us what the treatment would be and what kind of leukemia he had. But before we got to that appointment, Gary had an emergency with his spleen. He was in severe pain. I had to call an ambulance to take him to the hospital because I couldn't get him there myself. When we got there, there was a discussion as to who would take over his care. He obviously needed surgery on his infarcted, very enlarged spleen, but surgery wouldn't look after him because of his leukemia. Hematology didn't know what to do with his spleen. It obviously had to come out. So he was in the hospital for 6 days until he was strong enough for them to take him to the operating room, and that was on a Saturday night at 8 o'clock. They did tell us that he had a 50-50 chance of survival. The surgery was very risky. But he came through the surgery and actually made a remarkable recovery. For the next 2 to 3 weeks, we did have home care with CCAC, and he did very well on his post-op recovery. He still was suffering, though, with lightheadedness, swollen legs, and the unwell feeling. But we weren't sure if it was the disease or whether it was post-op recovery. So 1 month after his initial diagnosis of leukemia, we had our first appointment at the cancer clinic, and it was much anticipated. So when we met with the oncologist, he told us that Gary had a very rare form of leukemia. It was MDS unclassified, and about 1 to 2% of all leukemias are this kind. He said, "I don't have much to offer you, but I do have one drug called Vidasa. It is an injection. You will have to come to the cancer clinic for it every day for 2 weeks, and then you will have 2 weeks off. You will repeat this regime 2 weeks on, 2 weeks off, for as long as Gary lives. And you will have to come every week for blood work and possible blood transfusions." But then he said, rather cheerfully, "I have one patient that is still doing this 2 years in." So that's what Gary heard. He heard one patient 2 years in, I can do that. 2 years more with my family and my friends, I can do that. What I heard was I felt like I had been kicked in the stomach. I heard a death sentence. I heard one patient only has lived for 2 years. And then I knew, thinking about 2 weeks on, 2 weeks off, and all of the appointments, that this was going to take over every aspect of both of our lives. This is when I wish palliative care would have been offered to us. From here on, we had so many questions, and only if we had a resource that we could contact. We went home and made arrangements then to work our life around all the appointments that were coming up. The sheet of appointments that was given to us was almost 2 pages long for the first time. So whenever we took our questions to the family doctor, he would always defer us back to the cancer clinic. He didn't want to step on their toes. And at one point, he even said to us, "I don't know what you expect. You're on chemotherapy." We found the clinic was always so hectic, so busy, that they really didn't have time to hear our questions about side effects or to follow up with us. So 4 months in, we were really struggling. Gary had so many painful side effects from the injections. He was short of breath. He had scalding at the sites. Every day that we went for injections, he had to have 3 of them, and they would have to rotate the sites, and sometimes the sites were open and excoriated. because of the Vidasa was just so toxic. He was needing constant transfusions, and the time between his transfusions were getting less and less, and really we're only lasting him about 5 days before his hemoglobin would drop again. We were losing ground. So on our monthly visit to the oncologist in August, when the nurse was doing the initial assessment, I asked him, "What about palliative care? Is there any way we can access palliative care?" He was very abrupt and said, "Palliative care is for the last week of life. You're not there yet." I felt devastated. I felt that I had been reprimanded. How dare I give up on Gary? How dare I ask for help? This probably, I would say, was the lowest point of our whole journey because we were lost. After another month of torturous injections and side effects, we consulted with our adult sons, and we made the difficult decision to ask to stop the chemotherapy. And we knew full well that this would be the end. But the appointment did not go as planned with the doctor at the cancer clinic. He said we needed to give it 1 more month to give it a 6-month trial. He said but at that point he would do another bone marrow biopsy and we would see where we were at. Once again, we were devastated. We had agonized over this decision, only to be told it was not an option. So that appointment, Gary needed 2 units of blood as well as platelets. So while he slept through the extra 5 hours that we had to spend at the clinic that day, I went to the main cafeteria to try and clear my mind. I ran into a nurse that I had worked with 20 years prior in the emergency department, and I asked her what she was doing now. Well, she is a palliative care nurse for inpatients. So I told her my story, and I gave her my contact number, and she said she would see if there was something she could do for me. That evening, when I went home and Gary was resting, I decided to go for a walk in the neighborhood. And I had a neighbor who had recently moved in, and I knew that she worked for Cancer Care Ontario. So I got up the courage and I went and knocked on her door. And I told her my story, and I asked if there was anything, if she had any suggestions for me. Well, she told me that I could self-refer to CCAC Palliative Care. I had no idea. I had a plan. So the next morning, the first thing I did was I contacted CCAC and set up an appointment for later in the week. That same day, I got a call from Dr. Hamilton. He's a visiting palliative care physician, and his office nurse set up an appointment for the next day. And he came and brought with him his resident. After his visit, within 24 hours, we had oxygen delivered, a hospital bed, morphine, and medications to help control Gary's many side effects. What a boost that was. CCAC supplied the palliative care nurses that came and supported us almost every day. So we were so thankful. We had some help now to share the load. Gary seemed to have a boost for a couple of weeks, and he was able to visit with friends. We had visitors from out of town. We celebrated our 42nd wedding anniversary. Gary had his 67th birthday, and we celebrated Thanksgiving with our families. Our last visit to the oncology department was in October. That was 3 weeks before Gary died. This time with us, we had a social worker to help support us as we asked the doctor to stop the chemotherapy. He agreed. So as we were leaving, Gary shook his hand and he said, "I want to thank you for everything that you have done for us." The doctor was taken aback. He said, "Oh, I'm going to see you. Just because you're not having chemotherapy doesn't mean you won't be coming to see me every month. I'll see you next month." As we laughed, Gary and I both knew this was not going to happen. So with the help of palliative care through CCAC and Dr. Hamilton, we were able to support Gary at home. 2 nights before Gary died, he asked for the boys to come for a visit because he said to me, "I'm not sure I'm going to make it through the night." So I called our sons. One was on his way home from Toronto, the other one lived in St. Mary's, and within an hour they were both there. But after Gary had had his shower, he felt better, and he was sitting up in the chair and greeted them as they came in the door and said, "False alarm, I'm feeling okay." So they stayed for the evening, and it was one of the best visits ever. They watched the hockey game together. So that was the next day, or that night, they both went home and canceled their work for the next week, for the following week, because they knew they were going to be needed. So the next day, they both brought their families for a visit, stayed for supper, although Gary was unable to join us at the table. And that was the last day that Gary was awake.